Thank you so much. Uh, my name is Nebiyu Lera, and I would like to say thank you very much for Texila team and the Texila University to give me this opportunity. I'm presenting challenge faced by healthcare providers in providing service to key population at risk of HIV in Ethiopia. My summary: as one of the many goals of participation framework between the government of Ethiopia and the US government, Ethiopia has set a national target of reducing new HIV infected by 50% by the end of 2014 national target. Ethiopia has an estimated adult prevalence of 1.5% and about 1 million people living with HIV/AIDS. And among countries most affected by the epidemic, the International Labour Organization projection of 2015 indicated that as much as 8.5% of the Ethiopian labor force loss will be due to HIV/AIDS deaths World Learning 2012. Summary: the many problems in the HIV/AIDS discussed in Ethiopia appear to be behavioral change but no lack of knowledge. In addition, contrary to the widespread public belief that homosexuality is on North Ethiopia, there exists a flourishing undertone male sex and trade in Addis Ababa. The problem: I examine historical, social, and prevailing political and development challenges of Ethiopia. The next 4 seasons provide an overview of country context and the background of HIV/AIDS in Ethiopia. Ranging from primary and secondary literature review, including the assessment of government of Ethiopia HIV/AIDS, publication and legal documents. PR donors profiles and procurement exercise in the Ethiopia section investigates response to the HIV/AIDS threat and describe the ongoing challenge to the sustainability of the national HIV/AIDS response. Ethiopia is faced with of development challenges, including sustaining the progress made in recent years towards the MDG, addressing the cause of poverty among its population, sustaining the large-scale donor support using aid effectively, improving governance and improving local authorities, and for the government to become more accountable to its citizens. World Bank 2013a. Methodology: the CDC Center of Disease Control and Prevention AIDS program provided extensive technical exercise in area of blood safety, antiretroviral treatment service, laboratory infection, and providing strategic information. CDC works in collaboration with 23 other implementing partners, including US-based universities, example University of Washington, Columbia, Johns, and other local and international partners. Summary of literature review analysis. However, since the late 1990s, the response to the epidemic has been according collective effort of government of Ethiopia, multilateral and bilateral donors, national and international non-government organizations. In 1998, government of Ethiopia adopted HIV/AIDS policies that outlined strategies for HIV prevention, care, and support. In 2000, the National AIDS Council (NAC) was established to oversee the implementation of federal and general HIV/AIDS response. Results and discussion. Since the outbreak of epidemic in 1985 into the late 1990s, HIV/AIDS intervention in Ethiopia was inadequate in scale. It was larger, insufficient in implementation. It lacked sufficient stakeholder involvement in planning and implementation, particularly at religion and community level. It was poorly coordinated across sectors and among service providers, and it received relatively low priority with government, society in general, and the international community. Hypothesis: the major hypothesis of the research work is the global fund is the major source of fund for the national multiple HIV/AIDS response in Ethiopia. The global fund resources are challenged through the Federal Ministry of Health, Federal HIV/AIDS Prevention and Control Office Ethiopia, Network of HIV position in Ethiopia. Ethiopia has received US 8,003,720.322 from Global Fund, and 270,000 people are on ART as a result of the support Global Fund 2013. Significance of studies: expand the operational scope of the Global Fund. US President Emergency Plan for AIDS Relief, and the USAID and HIV governments pooled fund, and other NGOs at work directly with the private sector. Foreign aid has played a pivotal role in Ethiopia's development effort in the last few decades. According to the Getnet Alamu, following a regime change in 1991 and with the implementation of World Bank Sector Adjust Program in 1992 and 1993, in particular, Ethiopia received a significant amount of foreign 2019. This is my reference. Conclusion: coordinated and targeted HIV prevention strategies such as the Mulu HIV prevention certainly contribute to the success of the national target. The Mulu HIV prevention invites use a collaborative approach and engaging citizens, the private sector, government agency, and the international development organizations to track the epidemic. Contrary to the widespread public belief that homosexuality is not Ethiopian, scholarship indicates that not only the practice of homosexuality did exist in the country, but also a flourishing understood male sex trade. This in the warrant attention for the prevention of HIV/AIDS among MSM, or men who have sex with men, and the generation public. Future research: one, policy formulation on how to elevate the economic burden of occupational elements associated with risk jobs should be considered in Ethiopia and the possibility in other developing countries. The second, it is the pretense for other interested researchers to carry out more studies in order to exploit the economic implementation of HIV on large population. The talent of research in this direction should be extended to other risky occupations apart from querying that can be associated with HIV. The other possibility factors that can be responsible for the HIV of the work should be taken into consideration in the subsequent researches. Appreciation. Thank you so much. Thank you for all of you.